runner's knee. It's one of the most common injuries I've helped runners get rid of over the last 3 years. I'm Dr. Alex Warren. I specialize in helping runners rehab and recover from injury so they can get back to running pain-free and crossing the finish line on race day with a new PR. Most runners are told they need to foam roll their quad or their IT band and then stretch those same areas because they're tight around the knee, and they're told that that's going to get rid of their runner's knee. Or you've been told to cut down on your mileage, take some slower pacing runs, or stop running altogether. If you've been following any of these strategies and the knee pain still pops up when you start to increase your mileage with your runs, or maybe the knee is aching hours after the run or days after, and when you go to start that next run, it's still there, then foam rolling, rest, or stretching is simply not enough. What you actually need is to figure out why you're having that knee pain, and the plan you follow after that might surprise you. So first, we'll cover why your knee starts to hurt every time you increase your mileage, and I'll walk you through my 3 most effective techniques to get rid of your runner's knee without you having to stop running. If you have knee pain when you run, then naturally you would think foam rolling and stretching those muscles around the knee, or even taking a rest from running, would get rid of your knee pain. But the muscles around the knee are not shortened, so they don't need stretched. And the foam rolling, yes, it does feel good, but as soon as you go to increase mileage again, that pain's gonna pop right back up. Because overlooked areas like your pelvis and your shin bone, aka your tibia, is actually what's causing your knee pain. Most people don't have enough tibial internal rotation, meaning this shin bone doesn't rotate in enough when the knee bends, because when you have a more bent knee when you're running, it's able to absorb more force, whereas a straighter knee doesn't absorb as much force and causes pressure to flow to the knee, which causes that runner's knee. And when we look at the pelvis, most people are stuck in an anterior pelvic tilt, meaning they're not able to get into a more external rotation of the hip, which helps us push through the ground during single leg stance, which is all running is one leg changing to the other, putting force through the ground. This is why you can foam roll and stretch as much as you like or take as many breaks as you want from running, but until we look above and below the knee to get the full picture, that knee pain's always going to come back every time you go to increase your mileage. So again, making sure the areas above and below the knee are doing their job so the stress doesn't flow directly to the knee when you're running, which will then get rid of that runner's knee every time you go to ramp up your mileage. And I'm going to show you exactly how to do that right now. Before I go into daily reps and sets, if you guys found value in this video, please go down and like and subscribe. It just helps the channel grow and it allows me to reach more runners like yourself who are dealing with running related injuries. So you're just going to set up in a staggered stance, get that foot out in front of you. And I want you to think about placing a lot of pressure through your heel. And all you're going to do is drive the knee over your second toe as that knee bends. And you're just going to let the knee bend and go as far as you can while keeping pressure and that heel flat into the ground. So from here, we're just going to rotate back out of it, let the knee fully lock out. That's the key here. You want to let the knee fully lock out, and then we're just going to repeat the process, keeping heel pressure and driving that knee forward, thinking about letting the inside of my arch of my foot flatten out like a paddle, and then I'm just coming back again, pressure through that heel, nice and slow the whole time. And you should feel either some pressure in the arch of your foot or like a good stretch in the back of your calf, maybe the Achilles area. And I'm just working, and you'll notice as I drive my knee forward, it's not just straight like this. You'll see a common mistake. People just drive the knee forward, or they'll naturally push the knee over. Okay, I'm rambling. So you'll notice as I drive the knee, I'm actually rotating and opening up my chest and my belly button at like a 9 o'clock from where my knee is pointed. So I drive the knee, bend the knee, and then I'm just rotating my hips open. So what I'll see a lot of my clients doing is they'll drive the knee and then rotate. So you've lost the exercise here. So the key is to just drive the knee forward and rotate the hips. So the next exercise we're going to work on to hit the pelvis and work more of a posterior pelvic tilt like we talked about and get that hip extending and rotating is a side bridge. So a good setup is key for this exercise. So if your legs were just laying straight here and you're on your elbow, what I want you to do is bend the knees forward. So now if you were to rock, you have some stability. And I want my elbow through the ground here. So from here, I'm gonna push through the outside part of my knee here that I'm pointing to, and I'm just raising up, bridging my hip, and coming back down. So an important part of this exercise is I have a flexed hip here at the bottom, which is more anterior tilt and internal rotation of the hip. And at the top, now we're getting this posterior tilt extension that we were talking about earlier in the video. So to really get the most out of this exercise, you want to start with bent knees, hip flexed. And then as I lift up, I really want to push my hips through and extend, almost like there's a wall here in front of me and I'm trying to push my hips to the wall. So this last exercise would be a wide stance goblet squat. So this exercise is actually a 2-for-1. So here we're going to work on that shin bone rotating in, but then we're also going to work on the position of the pelvis and the hip. So again, setting up for this exercise to start is really a huge piece of it. So you want toes pointed out in a wider sumo stance. So the way I like to get in it, if I was just doing side-to-side rocking here, like to get into a normal body weight squat, I want to just widen my stance just maybe 1 to 2 steps each side, and then I'm pointing my toes out almost like a duck foot position. And then again, I'm keeping good heel pressure like the exercise before, and I'm driving my knees over my second toe as far down as I feel like I can go, and then I'm coming back up. So the most common mistake I see with my clients when they do this exercise is as they're going down for the squat is they start to get real flary with their ribs and arching their back, and now we've lost the position of the pelvis. So to correct this, I really want you to focus on doing that posterior pelvic tilt, bringing your belly button to your chin and tucking your tailbone underneath you. Heavy heel pressure, wide stance, driving the knees out over that toe. And you'll notice my rib cage stays stacked over my hips as I get into the squat. And then I push back up and I keep that nice stacked position, rib cage over my pelvis. So getting some more weight here will actually help you get into that squat position better. It's harder when you have less weight and body weight. So I would encourage you to start with some weight that's comfortable for you. So for the standing pass-throughs, you can do these daily for 2 sets of 10 to 15 reps, all the way up to 20 on each side. And then for the side bridges, you can do 2 sets of 10 to 15 reps on each side, and then alternate these every other day. So if you're having knee pain with the pass-throughs, you might need to dive a bit deeper to see what your mechanics of your foot are doing, because you may not be pronating correctly. And then for the sumo goblet squats, I would do these 2 times a week, maybe 3 times a week maximum. I would do 2 to 3 sets, 8 to 12 reps. I would do a slow eccentric squat, 4 seconds down, 1 second pause at the bottom, and then just normal tempo up. So if the goblet squats are causing the knee to hurt, start by dropping some of the weight or even looking deeper into the foot, again, to see if you're pronating or doing things correctly with your foot mechanics. And then in some cases, you might actually need to address the quad directly, but you don't need to stretch the quad. You actually need to probably strengthen it. So I would do something like this reverse Nordic, which eccentrically strengthens the quad, which is essentially all running is. It's eccentric forces put on the quad every time you go to put your foot in the ground.